Question 16. What's the first intervention for a patient experiencing chest pain and has an O2 saturation of 89%? Is it administer morphine, oxygen, sublingual nitroglycerin, or an ECG? All right, what are we thinking? And the answer is B, give oxygen. Some people are just like, what? All right, so administer supplemental oxygen to a patient is the first priority. Administer oxygen to increase the SpO2 to greater than 90% to prevent further cardiac damage as part of physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. All right, so question number 17, which of the following signs and symptoms usually signifies rapid expansion and impending rupture of an abdominal aortic aneurysm? Is it abdominal pain? Is it an absent pedal pulses? Is it chest pain or lower back pain? So here we go. And the answer is D, lower back pain. Lower back pain results from the expansion of an aneurysm. Anyways, physiological adaptation. All right, 11 to 17% on the NCLEX exam. Here we go, question 18. In which of the following types of cardiomyopathy does cardiac output remain normal? Is it A, obliterative? Is it restrictive, dilated, or hypertrophic? What are we thinking? And the answer is D. It is hypertrophic. So hypertrophic cardiomyopathy is a condition in which there is a severe ventricular hypertrophy and poor diastolic filling in an autosomal dominant condition wherein the heart's muscle, asymmetrically increase in size and mass along the septum. The increase in the thickness of heart muscles reduce the size of the cavities of the ventricles, causing them to take a larger time to relax after systole. Cardiac output isn't affected by hypertrophy cardiomyopathy because the ventricle sizes remain relatively unchanged. That is part of physiological adaptation, which is 11 to 17% in the third largest section on the NCLEX exam. Here we go. Question number 19. Which of the following interventions should be your first priority? Keyword is first when treating a patient experiencing chest pain while walking? Is it A, have the patient sit down? B, get the patient back to bed? C, obtain an ECG? Or D, administer sublingual nitroglycerin? What are we thinking? And our answer is A, have the patient sit down. The initial priority is to decrease oxygen consumption by sitting the patient down. Hey, sometimes, honestly, it really is that easy. You got to rest them. When you have patients that are ambulating on the floor and you know that they may have difficulty breathing or based off of their mechanism of injury of how they came into the hospital, somebody's going to be walking behind that patient with a chair of some sort. All right. They're going to be walking with a chair of some sort by our celly. So physiological adaptation, 11 to 17% on the NCLEX, making it the third largest section on the NCLEX exam. This is both for RNs and LPNs. All right. Here we go. Question 20. Which of the following positions would best aid breathing for a patient with acute pulmonary edema? Right. So is it lie flat in the bed, left side lying position, high Fowler's position, or semi Fowler's position? For somebody who has acute pulmonary edema, what are we thinking? But the answer is C, high Fowler's position. High Fowler's position facilitates breathing by reducing venous return. Lying flat and side lying worsens breathing and increases heart workload. That's part of physiological adaptation, which is 11 to 17% on the NCLEX exam.